Okay. Today we are going to discuss about the diagnostic services and what are the diagnostic services and different type of diagnostic services implications. What are the benefits? What are the plus minus of that type of diagnostic services? What is the administration point of view in the context of that diagnostic services? How the management or the administration they are supposed to uh, do the planning of this diagnostic and the diagnostic services. Okay, so why first we must understand what is the diagnostic services and what is the purpose of that. So I think this is a very basic kind of thinking. Diagnosis services are that services which actually help the doctors to just ascertain any kind of disease or when the patient doctor sees the patient or examines the patient based on his or her clinical history, present history, past history, and family history. Based on that, clinically he can make the diagnosis. But always there is a chance whether the diagnosis is 100% correct or something like that. So these diagnostic services they only help in ascertaining the, or you can say ensuring the diagnosis, probable diagnosis, provisional, that is called as provisional diagnosis. In diagnostic services, role of this diagnostic services, and basically they are essential for identifying disease, and it's also helps in monitoring of health and guiding treatment in the hospital. As you know, the patients who is admitted in the hospital at a continuous regular interval, his blood test or her blood test is going to be, or different kind of tests they are going to be advised by the treating physician based on the clinical condition of the patient. So diagnostic services they also play an important role in monitoring of the clinical condition of the patient also. And it's classified basically into two types. One you can say that is called as the invasive and the non-invasive. There are two type of diagnostic services, and what is the importance of this diagnostic services? They help in the accurate diagnosis. As I told you, by asking the patient or by examining physical examining of the patient, even as a doctor we can come to a certain uh, diagnosis or a certain kind of probable diagnosis for. But as you know, the time is of the quality, and everybody wants whatever the care is given to him, that should be accurate and the very specific. So for that only these diagnostic tests are being utilized. And over a period, new diagnostic tests they are coming up in the market, so that doctors they can do the precise diagnose the disease very precisely. And now because of this artificial intelligence, if you see the newspapers or some following some kind of health snippets and all that, so now it is practically possible to diagnose the breast cancer even 5 years before the appearance of the clinical symptom. So that is a technology kind of thing, artificial intelligence that can do that. And of course, for that artificial intelligence needs to be trained and all, and lot of data is going to feed, you have to put for this artificial intelligence, and then over a period that artificial intelligence start diagnosing the disease. So that is the purpose of this importance of this diagnostic part. And in the hospital, for the administration point of view, this diagnostic services they impact the patient flow, cost management, equipment procurement, and the quality assurance. Means impact the patient flow. If your hospital is all kind of basic sort of diagnostic facilities are available, patient normally the things whenever they are visiting the hospital, they always prefer a hospital where all sorts of care and the all sort of facilities are available. So if you have diagnostic facilities, whether you have to plan diagnostic facility as a hospital administrator, you have to think upon what is the demography of your community where the hospital is running, and what are the type of cases, and based on the whole analysis of such cases, you can easily come to know which kind of diagnostic services you need in your hospital. Okay, so that is the planning part, which is supposed to be carried out by the hospital administrator in the consultation with the doctors. So the doctors are the person who can give you the broader view of the things. And same times, if you're working in some hospital, you have to take your management in the confidence also. So that is the regarding the planning of this diagnostic services. And why it is important? Because this is a WHO figure. Approx whatever the bill is being generated, whatever the health expenditure is being incurred for managing the patient, almost 10 to 15% of that bill is comprising of this diagnostic services. Okay, and maximum percentage of bill is being contributed by, I think most of the people you are knowing, that is from the medicine part. Approx 45 to like a 50 or 6, sometime it may go up to the 60. That much percentage of money is being incurred on the medicine part. That's why a lot of efforts are being done to provide the medicine at a normal cost, or some generic kind of medicines are also being advised you should procure this generic medicines because of this rate. Because ultimately, if you're not covered with this any kind of insurance or something like that, all this expenditure you have to bear by your pocket. You have to pay the money from your pocket, and this will raise the increase in the out of pocket expenditure. And that out of pocket expenditure sometimes it may so high कि you have to cut down your other expenditures, your health condition. They just force you to reduce the other expenditure of your well-being of your life, which is required, is very much required. तो आप वहां से अपने खर्चे कम करके you start putting the expenditure on the healthcare. That is technically in the economics and in the healthcare sector, that is known as the catastrophic effect of healthcare expenditure. ओके, जब हम अपनी बहुत सारी जरूरत की चीजों को, सपोज फॉर जस्ट एग्जांपल आई वांट टू मेक यू अंडरस्टैंड कि किसी घर में 3 बच्चे हैं एंड दे आर गोइंग सम पब्लिक स्कूल, बट सडनली घर में किसी एक बच्चे की या किसी भी एडल्ट की तबीयत इतनी खराब हो जाती है एंड इंश्योरेंस फैसिलिटी इज नॉट देयर, तो उसके ऊपर मेडिकल के ऊपर जो खर्चा लगने वाला है वो कहीं बाहर से तो आएगा नहीं, बिकॉज इनकम इज फिक्स काइंड ऑफ थिंग। तो उसी इनकम में से उसका ट्रीटमेंट भी कराना है, तो परिवार डिसीजन क्या लेता है कि ठीक है हम अपने सारे बच्चों को पब्लिक स्कूल से उठा के हम गवर्नमेंट स्कूल में डाल देते हैं। तो दिस इफेक्ट इज नोन एज द कैटास्ट्रोफिक इफेक्ट। ओके, कि हमने अपना हेल्थ केयर खर्चे के लिए जो अपनी नॉर्मल वेलबींग की चीज थी, सपोज वी आर टेकिंग 2 times और वी आर हैविंग fruits per day, but because of this health expenditure we have reduced in the consumption of the fruits, while as that is a part of your well-being. So this type of effect, that is called as the catastrophic effect. Okay, and this catastrophic effect finally it converts into the empowerment. And why it comes to the empowerment? When you have to borrow the loan, when you have to sell your land or something like that, that condition is known as the empowerment. So that's why ultimately whatever the expenditure is being incurred in terms of the diagnostic services, in terms of the medicine services, in terms of any kind of intervention, surgical intervention or something like that, financial protection is very much required. Otherwise, that out of pocket expenditure is going to be imposed kind of burden on the individual patient. So that is the importance of this biomedical this diagnostic services. As 10 to 15% amount is not less amount. If we are able to reduce that as a hospital administration, if we can plan how the money can be reduced on this particular aspect, then it is good. Okay. Now, as I told you, there are two type of diagnostic services. So first, I will just tell something about the invasive diagnostic services, and word itself says this is the procedure that involves some kind of penetration or entry into the body, often breaking the skin or mucous membranes. And this requires, because you cannot put anything into the body without proper hygiene or the cleanliness. So that particular equipment and that particular things, they require to be highly sterile techniques. You need sterile technique. You need sometimes anesthesia also, or sometimes you need surgical intervention also. तो ये सारी जो चीजें होती हैं, they are just doing some entry into the body through all these kind of routes. Okay, sterile technique ho gaya, anesthesia is one thing, and the surgical intervention. Some surgical intervention are done as a diagnostic procedure also. Same time they provide the clinical management also. Suppose some kind of drainage from the gallbladder or something like that. Okay, and these in invasive diagnostic services, there are higher chance of complication, as clearly understood. When you are penetrating the body, you are inserting something inside the body, and if it is not being properly sterilized or something like that, there is a high chances of infection. Or sometimes these diagnostic procedure, if you are taking some biopsy or something like that, there is a chance of tissue damage is also. Sometimes bleeding may be there if you are taking some sample, suppose then bleeding can also occur because of you can say improper technique or something like that, not properly trained person or something like that. And these invasive diagnostic procedures, they are typically performed in a specialized unit. Non-invasive diagnostic services, they can come, they can be done on in any location. They can be done in the camps also. They can be done in any location. But these invasive diagnostic procedures services, they are supposed to be conducted in some specific kind of unit, and which are supposed to be sterilized in nature. That is a you can say primary requirement for conducting this invasive test. Okay, and what is the goal of this particular kind of invasive diagnostic services? Obtain direct samples or visualize internal structure for precise diagnosis. As you know, in the non-invasive may report takes some time, but in this invasive procedures, many things you can see directly also. Okay, if you do some kind of endoscopy or something like that, all the things they are visualized on the screen. Of course, finally typed report is being issued by the radiologist and all that. But by seeing that, you can see whether the what is the current situation. You can see the what is the status of the gallbladder when you are doing some kind of endoscopy and all that. What is the, if there is any kind of obstruction or something in the in your food pipe, in your the intestine or something like that. These all can be visualized by these kind of invasive diagnostic services immediately. But the proper report, authentic report, is supposed to be made by the radiologist, which may be available after a certain period of time. That depends upon the availability of the diagnostic radiologist person. Okay, so that is the thing. And if you talk about few examples, as I told you, biopsy, that is a tissue sampling, and we take by the needle biopsy in the case of cancer dissection. So as you know, okay, now this technique, they are going to enter into the body. They are piercing the skin, they are piercing the mucosa and all that. So that is why this is invasive. Same time, endoscopy, we are putting some kind of endoscope through the mouth, sometime through the mouth, sometime through the upper rectal also, colonoscopy and all that being done. So you are putting the equipment inside the gastrointestinal tract. So that is again the invasive angiography. Most of the people, you know, ki this is the study of the cardiac vessels, ki how they are supplying the heart. And by putting the dry and some kind of camera, we are taking the pictures and all that. So that is again, you are entering the body. Lumbar puncture, it's a very common kind of diagnostic procedure which are being carried out in the hospital. But again, this is a piercing kind of thing. Needle is inserted into the spinal canal for the CSF fluid, and by taking the CSF fluid, we further we investigate and try to find out or try to correlate the symptoms with the findings of this particular sample. Okay, bone marrow aspiration. This is also needed to diagnosis some kind of bone cancer or something like that. Okay, or distance metastasis of cancer. Bronchoscopy, it actually sees into the airway and the lung. Arthroscopy, it is the purpose to see the joint. And because of this, now this arthroscopy, it not only sees the joint. Now there is a repair, arthroscopic repair of the ligament, and a lot of arthroscopic surgeries. They are being prevalent in the hospitals. So this particular arthroscopy, they are not only the diagnostic tool. Sometimes they are also involved in the clinical intervention also. You provide some kind of treatment, or you do some kind of surgeries also for the ligaments and all. Then we say this invasive electrophysiology study catheters for the heart rhythm analysis. Okay, and often it can be combined with the therapeutic indications also. जैसे हम कभी कभी एंडोस्कोपी जब करते हैं तो ड्यूरिंग दैट टाइम ऑल्सो वी टेक द पीस ऑफ दैट पर्टिकुलर area for the biopsy, for confirming any kind of, suppose I am doing some kind of biopsy and I found ki some there is some obstruction at the stomach, at the upper part of the stomach. तो ऐसा नहीं है कि again I will do the endoscopy, then I will do the endoscopy. Same times I will try to take out the piece of that particular mass for the biopsy also. Okay. And what is the again administration part? As you know, this is a complicated procedure. So as a hospital administration, you must ensure whatever the person who are detailed for the diagnostic services, they should be properly trained. You can imagine what may be the complications if you don't have trained staff and they are performing such kind of very complicated or such kind of very complex diagnostic services, which can damage the body up to a unexplainable level also. So that is required, and most of this diagnostic invasive diagnostic services, they require the consent form also. In other non-invasive cases, in maximum cases you don't need any kind of consent form, but in this you need the consent form also. And many cases you need the post procedure monitoring also. You have to keep the patient. Suppose you are taking you are doing the some lumbar puncture. So after doing the lumbar puncture, immediately you cannot say the patient कि ठीक है आपका हो गया आप जाओ. That cannot be done. Even after this bronchoscopy, even this after this arthroscopy, immediately you cannot say कि आपने किया and you just tell the patient कि now your thing is over, you can go. It is not like that. For some time, patient has to be kept in the observation. So as a hospital administrator, you have to see, because each and every step there is a cost factor is there. First, you are doing such complicated procedure which is already costly. Second, if you are making some bed occupied by such kind of patient after the procedure, so definitely you want some kind of money in lieu of that bed occupation. So you have calculate that money also same time. And if patient stays more more than 2 hours, 4 hours, or 5 hours, so sometime other services you need to provide. Means housekeeping services maybe need to provide to clean the room. Sometimes you need other kind of services, some kind of dietary things you are supposed to provide. When you are making or you are provisioning for this diagnostic facility in your hospital, you need to cater all this cost concept also for deciding the cost of that particular diagnostic services. Okay, and this diagnostic services can be vary from the location to geographical location, vary from the hospital to hospital. If hospital is a NABH, of course their charges are on the higher side. If hospital is JCI accredited, then that charges is higher than the NABH. And if it is a normal kind of hospital, then their charges are reduced. Their charges are not so much. Now it's a matter of it's a concern for thinking why this kind of pricing is being done. While as medical says, if somebody needs lumbar puncture, it is supposed to be done in a very ideal kind of condition for each and every person. Okay, whether he is paying 5 rupees, he is paying 15 rupees, he is paying 30 rupees. So what are the things which made the things cost of the diagnostic services different from hospital to hospital? Okay, so that is the thing what I told you. The other the services you are providing to the patient, other type of comforts which may not be mandatory to provide all patient, but the patient who is in the position to pay for that comfort, because every patient has a different kind of expectation from the medical care services. Not all the patient they are expecting the same thing. Some patient expect something, some patient expect something, and that is depend on their financial condition, their financial protection. If they have insurance kind of thing, then of course their expectation is very high. That is why it is being also told कि पब्लिक सेटिस्फेक्शन फॉर हेल्थ केयर सर्विसेज को लेके जो हायर इनकम ग्रुप है उसमें हमेशा कम होता है, while they are availing every time much more quality services than the low economic person. But if you talk about the satisfaction level is always found lower in the high income group. It is one low income group patient, he is very much satisfied with the normal kind of gesture or normal kind of procedure in the hospital, but it is very difficult to satisfy the higher income person because he pays more, and when the person pays more he expects more कि नहीं मैं तो ज्यादा पैसे दे रहा हूँ तो मेरे को ज्यादा सुविधा मिलनी चाहिए in any place, in the hospital also, and in the, if you take the example of the air services or the railway services and all that kind of thing. So when somebody is paying more, he expects the more. Same thing is also applicable in the hospital. While as hospital services, they are called as a services. They are not any kind of product or something, but still people need such kind of thing. So that is the important thing as a hospital administrator. You should take care of that. Okay. Now we see the advantage. What are the advantages of this invasive test and what are the disadvantages? Advantage, as already we have discussed, this is a high accuracy and the specificity is highly specific test. मतलब it it direct access to particular part where the actually we are suspecting the disease, and it always allows for the definitive diagnosis in the complex cases. That is the nature of this invasive test. This is a confirmatory test. All the invasive tests they are considered as a confirmatory test. Can be therapeutic also. As I told you, okay, when you are doing the colonoscopy, and in the colonoscopy on the video camera, you have seen that there are some kind of growth, maybe the polyp or something like that. So during that colonoscopy itself, you can remove the polyps. So that is the therapeutic also. So that is the advantage of this invasive procedure. And if you talk about what are the disadvantages, as already told, there is a higher chances of the complication, infection, pain, allergic reaction that is more prevalent in these invasive kind of tests. Cost is on higher side as a very sophisticated equipment is required, highly trained person is required, and recovery time is more. As I told you, na, कि whenever you are keeping the patient more than a period, hospital has to induce some kind of cost. कुछ तो cost उसका लगता है, and how do you cover that cost? That is the decision of the whole hospital management team. Then patient discomfort and longer recovery. All the invasive procedures they are complex in nature, so of course, this the comfort level is more in the patient, and that's why it takes longer recovery. Means you have to wait in the hospital for a few hours after getting this tested. Then ethical concern. Ethical concern means you need informed consent. That is very important. Most of the time in the hospital there is a kind of implied consent. Suppose some patient comes to me and I have written you have to go for the CBC or the urine routine microscopic examination, there is no need of to take any kind of written consent for the same thing, because when the patient is reported to you in the medical legal, that is called as the implied consent. यदि पेशेंट आपके पास इनिशियली आ गया है तो ही हैज गिवन डेट कंसेंट कि वॉट एवर द बेसिक थिंग्स यू आर डू यू कैन डू दैट, यू कैन, और जैसे फॉर द बीपी pulse temperature taking, you don't need any kind of consent form because they are all considered in the implied consent. Okay, only thing is that you have to take care of that. If you are a male doctor and if you are examining some female patient, so you must ensure that there must be presence of some female attendant. So that is one thing which we have to take care of that. Otherwise, all the non-invasive they don't need this informed consent, but all the invasive procedures, most of the procedures they need this informed consent because of the nature of the complications, because of the nature of the various other kind of side effect, because the recovery part is involved. So that is why we have to take the informed consent. That is a basic different point. And now we discuss something about the non-invasive procedures. and same as the word which self-explanatory. This is a non-invasive where we don't need to penetrate the body, and we are just using the external method to gather the data. And that is the we rely on the imaging waves or the sensors without breaking the skin. Lower risk hai, there is not much risk involved except in some cases radiation or something like that. Otherwise there is in the ultrasound and all that, there is no risk of anything. Okay, performed in the radiology labs or the clinics. ये कहीं भी इन टाइप की चीजों पे जगह पे किए जा सकते हैं. वी डोंट नीड एनी काइंड ऑफ वेरी स्पेसिफिक infrastructure or some kind of, we don't need for the x-ray room, we don't need any kind of sterilized x-ray room. Okay, of course x-ray room must be clean and it has to be hygienic, but it doesn't need any kind of sterilization. And the purpose of this non-invasive procedure is they provide initial screening or monitoring with minimal patient impact. If we take the example of the TB, initially we just do the chest X-ray, and based on the X-ray finding, if we feel that there is any kind of things which suggest that patient is may have the TB, then we further go for the CV0 test, which is the confirmatory test. Okay, तो इस तरीके से जो चीजें होती हैं, जो इनिशियल आपके नॉन इन्वेसिव टेस्ट है, दे आर considered as a most of the time they are screening or monitoring with minimal patient impact. बहुत ज्यादा डायरेक्टली पेशेंट के ऊपर कोई बहुत इम्पैक्ट नहीं पड़ता. देयर इज नॉट एनी काइंड ऑफ रिकवरी पीरियड, यू डोंट नीड टू होल्ड द पेशेंट इन द hospital for more time. And these are the few examples. If you see in the picture, X-ray that is being conducted for the identify to various bone-related issue, ultrasound that shows the, in the antenatal case, that shows the development of the fetus or the stage of the fetus. And for the other purpose also, if you want to diagnose any kind of gallbladder stone or something like that, then ultrasound is being done. MRI is again, it's a higher version of this X-ray. And CT scan, MRI. Actually, if you see the hierarchy of the investigation, then X-ray has something different role, CT scan is something different role, and MRI is something different role. X-ray does just shows you the picture of a part of body which has some kind of, you can say some kind of calcium and the phosphorus kind of content is there where the X-ray images are being drawn. While the CT scan, they provide the information about the nearby tissues also. CT scan and MRI, even they are higher than the CT scan. They provide the information about the surrounding tissue, and they also provide the providing the image of the various vascular supplies. Means they give the some kind of picture of this arteries, vein, and all that. Okay, so that is the basically implications of based on the these are the implications of this MRI, ultrasound, or something like that. Okay, and these are one few more non-invasive monitoring. That is the EEG, where we put a lot of leads, and that leads they are going to record the brain active various kind of activity which are going into the brain cells. Okay, then spirometry to just check the lung function, and BP that is a non-invasive procedure. And Holter is one thing which if you are from the medical background or you are working in the hospital, you must aware what is the Holter. It is actually wear by the patient, and they monitor the 24-hour, or a doctor decides if they want 1 day, 2 days, something like that. It is wear on the chest, and they keep on monitoring of health rate, how the health rate is fluctuate during the whole day. So that kind of monitoring is required sometimes when the ECG doesn't give any kind of conclusive information or something like that, or just to understand what are the factors which trigger the high pulse rate and high BP and all that kind of thing. So this Holter helps in that. So these are all the certain examples of the non-invasive test. And now we talk about what are the advantages of this non-invasive test. As you know, this is a minimal risk. less discomfort, there is no recovery time almost. And this is a cost effective, repeatable for the monitoring. Cost effective factor is very important. As we know, India, what is the economic condition of the people? Lost many people, they are surviving below the poverty line. So it is not feasible कि just एक patient आए और आप उसको फटाक से कोई उस टाइप का इन्वेसिव टेस्ट आप लिख दो, which is very costly, मतलब तो वो एक है. एंड क्विक रिजल्ट सुटेबल फॉर द स्क्रीनिंग लार्ज पॉपुलेशन, इट कैन बी डन इजीली. इन्वेसिव वाले में सपोज यू डू द बायोप्सी इमीडिएटली, you cannot get the result of the biopsy. It will take 2 3 days, then you will come to the this thing. But a non-invasive may you can come to know the result in a very lesser time. Then patient friendly, there is no needles or the incisions. Only thing is that if you are utilizing some kind of contrast for the CT, some kind of contrast for the MRI, because there are two type of X-rays are being taken. One is the contrast, one is the plain. So when you are giving the contrast, then of course you have to pierce the vessels. Otherwise, it is not feasible to introduce the dye into the body. And sometimes that dye can also do some reactions or some kind of thing also. So we cannot say, and in that situation also we are supposed to keep the patient for certain time. That's why I told you this line, no recovery time needed, is it is a correct in terms of if you take a generalizer thing, but in few conditions you also need some kind of observation period after giving this dye. Otherwise, there are chances of some patient reacts and all that. And before doing this contrast test, you need to do the renal function test of the patient. क्योंकि most of the dye they are excreted from the body through this kidney. और आपका किडनी यदि सही काम नहीं करेगा तो वो डाई जो है वो बॉडी से एक टाइम के बाद निकलेगा नहीं. And if dye is not going to get out of the body, it will create a certain complication. So that is very important. So if you see in the hospital anytime, if you are advising ki, doctor is advising ki some kind of contrast enhanced MRI is required. So as a hospital administrator, you must know ki this cannot be done directly. This needs a proper kind of KFT, kidney function test or renal function test. So you have to plan accordingly. Okay. Then what may be the disadvantage? May not be it is giving full detail or the accuracy in many cases. Potentials for the false positive or the negative requiring follow-up invasiveness. Sometimes whatever the test you are doing, they may not be giving the correct result. There are chances of the false positive and there are chances of the false negative also. Okay, what is the false positive? When there is no disease, but even the system or even the that particular diagnostic tool they are giving positive result. And sometimes there is a disease, but your system is giving a negative result. That may be because of lack of proper technique, that may be because of the some kind of machine error or you are not calibrating your machines timely. It may be due to the you are utilizing some kind of false reasons. There are various reasons which are being utilized. So all these reasons are there. You must ensure if something goes wrong in your hospital, you have to do this uh, fishbone kind of analysis and you have to find out what is the reason behind this particular kind of reaction or the particular kind of incident. Radiation exposure, as I told you, हालांकि hospital में it is your responsibility to ensure कि your patient should not get the dose of this X-ray. That is why in all X-ray room बाहर एक चीज और लिखी होती है कि no pregnant lady, they are not supposed to go for this any kind of X-rays or something like that. They're also advised ki not to be nearby the X-ray room. Sometimes they may be harmful. Limited in deep tissue और obscured area. Because बहुत ज्यादा डीप टिश्यू के अंदर हमको जाना है तो एक्सरे में पॉसिबल नहीं होता. Of course, a form of is the barium enema and all that. They're also the highly specific type of X-ray. But again, they're not going into a deep tissue that just show the some kind of um, change in the shape of the intestine or something like that. So that is also is there. And now we talk about some basic difference after understanding both this invasive and the non-invasive. So I think now it becomes easy for you if we talk about invasiveness and the non-invasiveness. Invasiveness, high entry into the body in case of the invasive diagnostic services, and non-invasiveness, it is not entering into the body. This this word is actually duplication. Okay, it is not direct entry. Okay. Then risk level, if we talk, invasive diagnostic services, as we discussed, there is a chances of higher complication. But in the non-invasive, there is very less chance of any risk or something like that. Accuracy, if we talk about this invasive diagnostic services, that is on very higher side. But non-invasive services, this is good for screening, but sometimes it may need the confirmation also. Okay, you cannot solely depend upon the MRI or something like that before coming to जैसे जैसे हमने किसी पार्ट का MRI किया and we found that there is some kind of suspicious growth, but that suspicious growth, you understand, you know that that may be the cancerous, but even without biopsy you cannot make your level or diagnosis as a cancer. So biopsy becomes a confirmatory kind of things, and biopsy is a invasive test. Okay, so that is needed for confirmation in some time. Cost and time is understood. It's a more expensive invasive diagnosis services, and more time is required to discharge the patient or to relieve the patient from the hospital. Okay, and non-invasive, it is a slightly on the lower side. It is affordable, but in many cases that depend upon the economic condition also, it becomes difficult for the common people also. And this may be the quick use cases where we are utilizing this invasive diagnostic service and non-invasive diagnostic when there is a complex diagnosis or some kind of many factors or many kind of uh, probable diagnosis you make. So for confirming that particular disease, you have to this invasive test, and that is why this is a complex kind of diagnosis, while as the invasive non-invasive is a routine kind of check. You are doing some x-rays, you are doing some kind of bronchoscopy or something like that, you are taking the BP, they are all in routine nature. Okay, so as a hospital administration perspective, you have to maintain the balanced based on your hospital capacity. Matlab, you have to understand which kind of footfall is in your the hospital. What are the patient demographics? The age factor is there, and demographic also contains the social economic factor is there. All on all these bases, you have to plan your these services. That is the admin perfect. It is not something like that ki you just bring the machine, you have installed the machine, and without considering all these factors, you just want to recover the money which has been incurred on the procurement of the machine. You have just mentioned, you have just defined some kind of rate. This is not a correct kind of administrative decision. So you must understand is this. And role in hospital management, resource allocation. If you are administrator, you must understand okay, for this all investigate, you need some kind of specialized manpower, you need some kind of specialist person. Okay, तो वो आपको थोड़ा सा ध्यान रखना है. फिर सेम टाइम जो आपके इन्वेस्टिव प्रोसीजर है उसमें एज ए हॉस्पिटल एडमिनिस्ट्रेटर यू हैव टू मेक more quality indicators for the safety. The more indicators you are observing in the area, most of the time it ensures that your services are more towards the patient safety. That is again the importance of then financial implication. आप as a hospital administrator, you have to define कि how you are going to utilize these services based on which model. DRG is one diagnostic related group which is not prevalent in the India. So I am not going to go into the detail. तो DRG का मतलब होता है diagnostic related groups, means for one kind of diagnosis or one kind of a clinical condition, the management or the cost of the that particular management, it is going to be same in the all hospital. Okay, so presently this concept is not existing in the India, but in the world, many countries follow this DRG kind of concept. Okay, and अच्छी बात ये है कि DRG में they are able to control the prices and all that. Okay, and workflow optimization, you have to, as a hospital administrator, you have to ensure ki whatever the integration with the EHR for seamless reporting, that is very much important. When you are sending the X-ray films to the packs and all for the reporting and all that, how that reports, they have to be linked with the electronic health record. That is important. Otherwise the person is sending the report and you are just not able to locate the report where the report is going to. That integration is again the concerning part for the hospital administration. And in any time, as a hospital administration, you should involve yourself in the strategic planning. Means, what is the strategic planning? This is the kind of planning which you do based on the immediate condition. Okay, so that is the strategic kind of planning. This in COVID, many labs they have started, they have installed this RT-PCR machine. Okay, because that time initially COVID test is being conducted in a very limited kind of institute or the places, and the number of cases were so high. Okay, it's very difficult to manage the conducting the test. So that is one thing. These are all the strategic decision you have to take. Okay, when to index the facilities, when to de-index the facilities. So that is all administration decision. And if we talk about the technology, there is integration of AI. Okay, minimal invasive steps, robotic endoscopy. They are actually not so much invasive. You need very minor kind of cut or something like that. Then we have Internet of Things for non-invasive monitoring. ECG monitoring can be done. Glucose monitoring can be done. Diagnosis is also one of the things which we can do with the help of this telemedicine. And for this technology there are some challenges every time, because you need to train your staff. Data privacy is a big concern. And revenue on interest, that is the return on interest, that is very much important. कि what you are getting, यदि आपने कोई न्यू टेक्नोलॉजी आपने लगाई है, तो वेदर इट इज प्रॉफिटेबल और नॉट. ऐसा तो नहीं कि आप revenue generate nahi kar pa rahe over a period. After a certain period only you can generate the revenue up to the breakdown period. So as a hospital administrator you have to think upon that. Then we talk about this patient safety, ethical and the legal consideration. As I told, informed consent is required. Risk management techniques, you must know what are the chances of any kind of risk, and your facility should have all kind of arrangement in case of any complications happens. On same time, ensure access to both in underserved areas also. As a hospital administrator, you should try to make available your diagnostic services if you are serving in some community which is non so much developed or something like that. Then ethical issues, you must make a balance. Over testing is a common feature, for just making the money or doing some kind of things. This over testing concept or over testing kind of trend is prevailing. So as a hospital administrator, you make ensure that there should be some kind of balances also. Malpractices risk, this is very higher in the invasive. So you make ensure that kind of checks are available in the hospital, so that any kind of malpractices can be reduced in the hospital. As in case of ultrasound, somebody may get tell the sex of the baby and take some money. So you have to, as a hospital administrator, you have to make ensure that such kind of practices should not be happen in the hospital. Okay, now this is the last slide of the today. Okay, what are the conclusions and the takeaways? Diagnostic services are pivotal for the effective hospital operations. Invasive, that is a precise but it is a risky. Non-invasive, it is a safe but efficient. And what is your role as an administrator? You have to make balance innovation. You have to make balance in the cost. You have to make balance in the patient decision also, which patient is required, which kind of investigation. And these are the few just question you can think upon that. How can a hospital optimize the mix of invasive and the non-invasive services? Just for thinking, as a hospital administrator, you can think upon that. And these are the certain references I have mentioned for this particular class. Okay, so for today, this is all from my side. And I hope with this lecture you have some kind of idea why we talk about this invasive diagnostic services, or we talk about this non-invasive diagnostic services. And one more thing that I want to tell you is I put the message into the group regarding the class, but mostly I will take the class tomorrow also for some other topic. Till then, good night. Enjoy. Thank you.
Thank you, sir. Good night.